Did you know that some foods widely recommended for heart health may actually be quietly reducing blood circulation after the age of 60, without pain, without alarms, and without obvious symptoms? Many older adults believe poor circulation is just part of aging: cold hands, cold feet, tingling, leg fatigue, mental fog. But in my experience, these are often early circulation warnings, not aging itself. I'm Dr. Bernard Lown. Over decades of treating seniors with heart and vascular problems, I've noticed something unsettling. Many patients didn't lose circulation because of blocked arteries or genetics, but because of foods they trusted and ate daily. These foods don't cause sudden heart attacks. They slowly thicken the blood, stiffen blood vessels, reduce oxygen delivery, and weaken flow to hands, feet, brain, and heart muscle. By the time symptoms are obvious, circulation has already declined. What I'm about to share may challenge what you've been told, but understanding it could help restore circulation you thought was gone for good. Before we continue, take a moment to subscribe and turn on notifications. This channel is dedicated to protecting senior hearts, blood flow, and long-term independence. And let me ask you, be honest, if you've experienced cold hands, cold feet, numb toes, leg heaviness, or poor balance, type 1 in the comments. If not, type 0. 1. Whole wheat bread is often promoted as heart-safe because it contains fiber. But after 60, the body handles carbohydrates very differently. As we age, insulin becomes less effective. That means blood sugar rises higher and stays elevated longer, even from foods considered healthy. Elevated blood sugar thickens the blood, damages the inner lining of blood vessels, reduces flexibility in tiny capillaries. Circulation suffers first in the smallest vessels, those feeding toes, fingers, and the lower legs. Real patient story. A 68-year-old patient ate whole wheat toast every morning believing it protected his heart, yet his feet stayed cold year-round. Tests showed no major blockages, but poor microcirculation caused by years of sugar-related vessel damage. The bread wasn't toxic, but his aging circulation could no longer tolerate daily blood sugar spikes. 2. Low-fat yogurt sounds like a responsible choice, but when fat is removed, manufacturers usually replace it with added sugar. In seniors, sugar causes chronic inflammation, thickened blood, reduced oxygen delivery. Inflammation causes blood vessels to swell inward, narrowing the pathway blood must travel through. Over time, circulation becomes sluggish, especially to the brain and extremities. Many seniors report brain fog, fatigue, cold limbs, yet never suspect their light breakfast. 3. Vegetable oils are often labeled heart-healthy because they lower cholesterol numbers. But cholesterol levels do not equal good circulation. Circulation depends on flexible, calm blood vessels. These oils are extremely high in omega-6 fatty acids. After 60, excess omega-6 promotes chronic inflammation inside the vessel walls. Inflamed vessels lose flexibility, narrow internally, and struggle to increase blood flow when needed. Blood still moves, but not efficiently. Real patient story. A 72-year-old woman replaced butter with vegetable oil after medical advice. Her cholesterol improved, but within months, walking caused calf pain and leg heaviness. Imaging showed no major blockage. The issue was inflamed, stiff vessels unable to deliver enough blood during movement. The oil didn't clog arteries, it quietly reduced their function. 4. Lean deli meats appear safe because they're low in fat, but circulation depends on a chemical messenger called nitric oxide. Nitric oxide tells blood vessels when to relax and widen. Preservatives and additives in processed meats interfere with nitric oxide production. When nitric oxide drops, vessels stay tight, blood pressure becomes uneven, flow to hands, feet, and legs weakens. What seniors often notice? Cold fingers in warm rooms, tingling toes, leg fatigue after short walks.
Because it's painless, most seniors never connect it to lunch meat. 5. Many cereals marketed as heart-healthy still contain refined grains and sugar. Repeated sugar spikes damage the endothelium, the delicate inner lining of blood vessels. The smallest vessels, capillaries, are damaged first. Capillaries supply toes and fingers, eyes, brain tissue. Real patient story. An 80-year-old woman complained her feet felt numb and lifeless each morning. Her arteries were open, but her capillaries were damaged from years of cereal breakfasts. Blood could reach her legs, it couldn't nourish the tissues.
Before we move on, there's something every senior needs to understand, because this is where many people get confused and misled. Many older adults are told, your arteries are fine, your scans look normal, there's no blockage. Yet they still have cold hands and feet, numb toes, leg heaviness, poor balance, fatigue when walking. Here's why. Circulation failure after 60 often has nothing to do with blockages. It has to do with blood quality and vessel behavior. As we age, 3 silent changes occur. First, blood becomes thicker. This happens from sugar spikes, dehydration, and inflammation. Thick blood moves slowly, especially through tiny vessels. Second, vessels lose flexibility. They don't open and close like they used to. Even without plaque, stiff vessels restrict flow. Third, capillaries stop responding. Capillaries are microscopic vessels that deliver oxygen directly to tissues. When they're damaged, blood reaches the area, but oxygen does not. This is why feet can feel ice cold even with a normal pulse. Legs can feel weak without pain. Hands can tingle even when tests look fine. Most doctors are trained to look for blockages, but circulation problems after 60 are often functional, not structural. And here's the key point. Foods don't need to clog arteries to destroy circulation. They only need to thicken blood, inflame vessel walls, or interfere with vessel signaling. That's exactly what the next foods do. Keep this in mind as we continue, because understanding this difference is what allows seniors to finally improve circulation instead of feeling dismissed.
6. Fruit juice is often viewed as natural and heart-friendly, but juice delivers sugar faster than aging circulation can handle. Without fiber, sugar floods the bloodstream. This causes blood thickening, vessel irritation, reduced oxygen transport. Thicker blood moves more slowly, especially through small vessels. Common signs: cold hands in the afternoon, fatigue after breakfast, lightheadedness when standing. Whole fruit digests slowly. Juice overwhelms circulation. 7. Many foods labeled heart-safe hide excessive sodium. As kidneys age, sodium removal slows. Excess sodium stiffens blood vessels, pulls fluid into circulation, raises pressure but reduces smooth flow. Blood reaches major organs but struggles to reach fingers, toes, and skin. Warmth fades, circulation weakens. Final message: the truth seniors deserve to hear. Here's the truth many seniors are never told. A food can be labeled heart-safe and still quietly damage circulation after 60. The damage is slow, silent, cumulative. But here's the good news. Circulation decline is not inevitable. When seniors remove foods that quietly strain blood vessels and support circulation correctly, warmth, strength, balance, and energy often return. Your circulation didn't fail overnight, and with the right choices, it doesn't have to stay this way. Which food surprised you the most? Tell me in the comments. If this video helped you, comment 1. If not, comment 0 and tell me what you want explained next. Like, share, and subscribe. You shape this channel, and your support helps protect more senior hearts. Thank you for watching. Your circulation matters.